When I was younger, I was really close to my uncle, and one thing that I noticed about him was that he always seemed really tired all the time. I never really understood why until one day we were in the kitchen and all of a sudden he passed out. I remember this day because I was crying in my room while my family brought him to the hospital, and I stayed in this sort of depressive state for a few days until my uncle came home and told us that he was diagnosed with type 1 diabetes. I am credible to inform you about type 1 diabetes today because of the extensive research I have done, including reading and analyzing articles from the CDC, among others. I also live close to someone who lives and deals with this disorder on a daily basis. The reason why you should listen to me inform you about type 1 diabetes today is to make you both smarter and healthier. The reason it will make you smarter is because by the end of the presentation, you'll have an extensive knowledge on what type 1 diabetes is. And it will make you healthier because you will learn how to treat and manage it if you or someone you know are ever diagnosed with it. Now that you know that I'm going to inform you about type 1 diabetes today, to do so I'm going to first talk about what type 1 diabetes is. Next I will discuss symptoms, and finally I will be discussing treatments. Now that I have introduced my topic, we can begin by first talking about what type 1 diabetes is. Type 1 diabetes is a disorder that prevents your pancreas from making insulin. According to Gilmer, founder of the Cleveland Clinic, which was named one of the nation's best hospitals by U.S. News and World Report, insulin is important because it regulates the amount of glucose or sugar in your blood. If you don't have enough insulin, too much sugar will build up in your blood, and your body can't use the food you eat for energy. Type 1 diabetes is not the only type of diabetes you can be diagnosed with. There's also something known as type 2 diabetes. The main difference between the two is that type 1 diabetes is an autoimmune reaction. This means that an individual's immune system attacks the cells in their body. On the contrary, if you are diagnosed with type 2, it is because your body doesn't make enough insulin, or your body doesn't use the insulin it created properly. The cause of type 1 diabetes is unknown. However, there are certain risk factors, such as genetics and age, that may make an individual more likely to obtain this disease. Type 1 diabetes is not very common, especially compared to type 2. However, it is usually found in children and young adults. The most common age is either 4 to 7 or 10 to 14. The main way to be diagnosed with type 1 diabetes is through a blood glucose test, which tests the amount of sugar or glucose in an individual's blood. We just went over what type 1 diabetes is, so now let's talk about some symptoms. According to members of the CDC, or Centers for Disease Control Prevention, which is a United States federal agency under the U.S. Department of Health and Human Services, it can take months or years before type 1 diabetes symptoms are noticed. And once symptoms appear, they can be pretty severe. The two major symptoms of type 1 diabetes are hyperglycemia and hypoglycemia. Hyperglycemia is high blood sugar, and this is very damaging to your body. Symptoms of hyperglycemia include, but are not limited to, eye problems, heart disease, and a possibility of a stroke. Hypoglycemia is the opposite. This means low blood sugar, and it is very dangerous for your body rather than damaging. Symptoms include, but are not limited to, shaking, sweat, nausea, and irritability. Besides these two major symptoms, which have symptoms of their own, people with type 1 diabetes may also experience symptoms such as extreme weight loss, hunger, thirst, and a weak bladder. There are also some symptoms that are not just specific to type 1 diabetes that people can experience no matter the type of diabetes they may have. These symptoms include dry skin, throat, numb fingers, and feeling more tired than usual. People with type 1 diabetes can experience anywhere from one to every single one of these symptoms. It all depends on the person and their situation. People can also experience symptoms years after they are diagnosed. Since I have just told you about some symptoms of type 1 diabetes, let's finish by discussing treatments for the disease. Two major treatments for type 1 diabetes include blood sugar monitoring and insulin therapy. Blood sugar monitoring, also known as A1C monitoring, is important because it helps keep blood sugar levels close to the normal target level. According to Maria Malzone, a well-known author from Gale Health and Wellness, which is known for its authoritative information on a variety of different subjects, recording and tracking blood glucose can reveal whether certain foods or activities trigger highs and low blood sugar. This will also let you know if the insulin dose one takes needs to be adjusted or varied throughout the day. Insulin therapy is the other major treatment for type 1 diabetes. And this is important because it helps delay and prevent complications. Insulin can be given either through an injection or an insulin pump, and the amount that one takes varies on the person and their blood sugar level. Besides these two treatments, diet and weight management are also essential to treating type 1 diabetes. More specifically, foods high in fiber and low in carbs are recommended because they help raise blood sugar levels while also preventing a sharp spike in an individual's glucose level, as this sharp spike can cause major complications. Although blood sugar monitoring and insulin therapy are the two more well-known treatments, diet and weight management is just as important in treating and managing this disease. Lastly, after covering treatments for type 1 diabetes, let's sum up everything I went over today. In this presentation, I have informed you about type 1 diabetes by first going over what type 1 diabetes is, next talking about symptoms that may arise, and then finally discussing possible treatments you can use to combat this disease. Thinking about it now, seeing my uncle pass out on the floor was pretty traumatizing, but especially because I had no idea what was going on or how I could help. However, after learning about his disease and how to treat it, my uncle's condition has improved significantly, and I personally feel more equipped to help if there is ever another scare. Learning about type 1 diabetes was crucial to helping his disease, and I only wish that I could have done my research sooner. Yet even though type 1 diabetes may have its ups and downs, my uncle is still the same person he always has been, and I look up to him just as much as I did in the past. No disease or disorder, not even type 1 diabetes, will ever change this fact.